And I'm back. We're going to be going live with the Chief Medical Officer of Pelvic Rehabilitation Centers in 1 minute. So I hope that we're going to have lots of people join us and ask us all the questions that have been weighing on your mind in regards to diagnosis or anything related to endometriosis. And I see that we have some people joining, so thank you so much for taking time out of your Monday to join us. So the doctor should be joining us here very soon, and then we'll go ahead and get started. So really excited to be able to share my journey with endometriosis and also get another professional's perspective on this horrible disease that affects 1 in 10 women. So I'm sure most of you know someone who has suffered from this disease, whether it be your mother, your sister, your grandmother, your aunt. If you ask around, I'm sure that there have been someone in your family who has been has had this disease. So I know when I got my diagnosis, I asked around, and sure enough, I had some family members who they suffered from the disease as well. So hopefully we'll be joined here very soon by the doctor, and we'll go ahead and get started. Hope everybody's having a wonderful Monday. So far, it's only 5 o'clock, right? So still early, but I hope everybody's having a great Monday. And hopefully we'll be joined here soon. Thanks everybody for joining me. For those of you who are just joining, we are just waiting for the physician from the Pelvic Rehabilitation Centers to join us, and then we'll go ahead and get started here. Does anybody have any questions before we get started? I see I have some people on here, so thank you for joining. Happy Monday. So if you have any questions, make sure you shoot them down below, whether it's in regards to endometriosis, nursing, being Mrs. Michigan America. So, all right, I see pelvic rehabilitation. Hello. All right. So let's see.
Hi, I'm sorry. How are you?
Good. How are you? Nice to meet you.
Thanks. I apologize for the delay, the trouble with the connection.
Oh, no worries. No worries at all. Happy Monday.
Happy Monday.
Yeah.
It's so great to meet you. I've heard such fantastic things.
Oh, thank you. Likewise.
Yeah, no, tell me about your journey and how long have you been doing pageants for?
Oh gosh, I started competing in pageants when I was 8 years old. So I begged my mom to let me compete in Miss Michigan preteen. She's like, "Are you sure you want to do that?" And I'm like, "Yes, I want to so bad," because I always watched Miss America.
Okay.
And so she let me, and I was hooked. So ever since 8 years old. So I won't tell you how many years that is, but that's a long time.
Oh my gosh, so cool. And
Thank you.
I was beyond excited when I heard your platform.
Thank you.
It's amazing work that you were doing.
Thank you so much. It is such an honor to be able to use my voice on behalf of the 1 in 10 women who suffer with this horrible disease. So I'm truly honored to be able to do that.
And it's so needed, and it's just such fabulous work that you're doing, spreading the word and just helping people who suffer like you, just educate them on the disease, and that really they don't have to suffer alone.
Absolutely. Yeah, that's what this is all about is, I'm a part of, support groups and whatnot, and there's so many women out there who feel like they're alone, and they're not. And that's truly what I, want to spread this message, that there's so many of us that are suffering, some of us in silence. And so they don't need to do that, because we're all in this together.
Completely agree. Completely agree. So how has your journey kind of shaped your career? It sounds like your career's been shaped by everything you've gone through as well.
Yeah, so I'm a registered nurse, and I actually was diagnosed my senior year with stage 4 endometriosis. So I can remember sitting in nursing school and just being in devastating pain, was in and out of the ER quite a bit, and I was worried I wasn't going to be able to graduate, just because I was in and out of physicians' offices and ER visits, and just was trying to figure out what was going on and why I was in so much pain. So, being able to, finally get my diagnosis, it just so happened, I one morning woke up and had pain that was a 10. Normally it was a 6 or a 7, and I woke up and it was literally a 10 out of 10. And I was like, I have to go do something. I have to call my OB. They got me in right away. I got an ultrasound, and I had a cyst the size of a baseball on one of my ovaries. And so I had emergency surgery, and that's how they found my endometriosis. So long story short, I wanted to know why I didn't know about endometriosis. Being in nursing school, getting ready to graduate, I wanted to know, why is it that here I'm a female and I'm getting ready to become a registered nurse, but yet there was very little that was talked about in a textbook. You get maybe a little tiny paragraph, and so I wanted to know more, and it truly has shaped me to, get the word out there to the medical community as well, just because there's so many nurses that just have no idea what this disease is.
No, that's great. And congratulations to you for graduating with all that going on. I mean, that's a lot on your plate all at once. Yeah.
Absolutely. And, they had started me on Lupron, and just the hot flashes and just everything was just absolutely horrible. And trying to, take tests and be in clinicals and trying to, stay focused. And it was just really hard. But I ended up graduating with honors. I really had to buckle down and, work hard, but ended up, graduating with honors. So I was happy with that.
Now you're using the degree to really, help spread the medical word about endo.
Absolutely. Yes.
That's so amazing. There's nothing better when you feel that passion and it happens to you. That's a powerful voice.
Yes.
That we all need. So.
Absolutely. I'm just hopeful that, through education, that women will know what to ask their physicians and hopefully get a diagnosis sooner. It shouldn't take 5 to 10 years to get a diagnosis and, be in and out of the ER or in and out of your physician's offices. And so if I can at least help, one person, this year and throughout my journey, then it will be more than worth it.
It's amazing. That's amazing.
Thank you.
Yeah, no, I completely agree. When I first got into the field, so I'm a physiatrist, but we treat really pelvic pain, chronic pelvic pain, which is the predominant symptom of endo, other than infertility, as we know. When I first got into it, it wasn't talked about. It was about 7 or 8 years ago. No one mentioned endometriosis or talked about it. It's just, for me, it was mind-blowing, just the percentage of our patients that had endometriosis as an underlying, disease process that caused their pelvic pain and their pelvic floor muscle dysfunction and their nerve dysfunction. It was really just this pro-inflammatory systemic disease process of endo.
Yes.
Same. And it's just been, these, poor patients, they're told to have a glass of wine or, just relax, be able to have intercourse or crazy things, just because as a medical profession, I think we're failing patients, but because we can't diagnose it. And, I think that's your educational and raising awareness for women. It's just, I don't think there's anything better. So
Thank you.
I'm very impressed with your platform.
Thank you. I appreciate that. And, there's so many times that, a doctor would say, it's just part of being female. I'm sorry. You're going to have pain. Just take some Tylenol and choke it up and, get on with your day. And I'm like, no, I know my body and I know this is not normal. So, I'm so thankful that there's specialists out there such as yourself who understand what it is that we're going through and are able to help, because there's so many physicians out there who just chalk it up as being female, and that's definitely not the case.
Yes. I mean, you have the benefit of a medical professional background too, and the education, and that helps. I think that's great. I mean, you're right. I mean, so many of us, even, we normalize our symptoms. We just, partially because maybe we're told there's nothing really to do about it.
Right.
But, it is. So many of our patients, oh, yeah, I have pain with intercourse, but I've always had it. So, or yeah, I go to the bathroom 4 times a night, but I've always done that. So you just start to get used to it and you normalize it. So, yeah, no, education and awareness is the biggest tool we can provide. And, even to younger females too, so they can know what's normal and then what's not normal.
Yeah, absolutely. And, that's one of the things that I do too is, go into schools and go to, health education classes, and I have the girls count off, and have, number 1 and number 10 stand up, and I have them look around and I say, these are, the people who will be diagnosed with endometriosis. 1 in 10 women will suffer from this disease. And it's just the girls that come up to me after, my presentation and my talk about my journey and about pain. They're just so thankful that someone has come into, their classroom and has shared that experience with them.
That is so great. That is so cool that you're doing that. I feel like we should maybe we should talk and collaborate, because that's exactly where I think it needs to start.
Absolutely.
Education on what's normal, what's not, red flags. Does your mom or aunt or cousin? I mean, there's such a family history that we don't even think to ask our family. But yeah, that's where I think it needs to begin.
Yeah, I mean, I never thought to ask my family either, and come to find out I had an aunt who, suffered from endometriosis and had infertility problems just like I did. I mean, it took us 4 years to be able to have our daughter. I mean, she's definitely a blessing, but again, it was going to multiple doctors who told me I would never have a family, or if I wanted to have a family, that I'd have to keep doing in vitro over and over again. And so, just talking about it and being around family and friends and letting them know that it's okay to talk about, these struggles that they have, it just has really opened, my eyes and their eyes that, there's a lot of people out there who are suffering.
That's amazing. And what other associations do you work with? I know you work with the Endometriosis Foundation of America, right?
Yes. So I am a huge supporter of the Endometriosis Foundation of America. They are doing some wonderful things. Just this weekend, they had their virtual conference, and it was so amazing just to hear stories of women who are, struggling. And they had a panel where, different aged women were talking about their diagnosis and how it's affected their life. And it's just so refreshing to be able to hear, everyone's story. And I always learn something new in regards to the disease and how people are, struggling with it, but how they're getting through it. Women are so strong and so powerful that, they push through, these barriers. And so it's really, it was really nice to hear their stories. But the Endo Foundation of America, the Endometriosis Association, and now the Pelvic Rehabilitation Centers. So I'm just really excited to be able to team up, with these organizations to, hopefully get the word out on a national level.
That's amazing. And do you find at this point, is it affecting your quality of life or your daily life, or?
It does. So it's still, we've tried so many different types of medications. We're back to the continuous birth control method. So I just started on a new continuous birth control. So far it's been helpful, but it's not, nothing is ever 100%. So I do still struggle, with the pain every day, but I just push through it, not only for myself, but, for my daughter as well. I have to stay strong for her.
Yeah, I saw a picture of her on your page. She's beautiful. Congratulations.
Thank you. Thank you. She's 3 and she's got quite the personality.
It's a fun age. Congrats.
Yes, thank you.
Yeah.
Thank you. Quite the blessing. I thank God every day for her.
It's amazing.
Thank you.
And now if you were going to, tell young girls in their, late teens or 20s, any pointers or body awareness tips, is there anything you would want people to know or that you learned from your amazing journey?
Yes, I definitely would tell them just to listen to their bodies. They know their bodies better than anyone. So don't ever let anyone tell you that it's something that's in your head or something that you just have to deal with. Seek out those answers. And if you don't get the answers that you want from, one physician, seek out a specialist, such as yourself, somebody who has taken the time to really understand the disease and, the process of, going through getting a diagnosis. So I would just tell them just to, keep seeking out those answers until they get the answers, that they deserve.
That's amazing. Yeah. You have to be your own advocate.
Absolutely.
Particularly in the world of endometriosis. That's great. Love it.
Thank you.
And, in a perfect world, how would you see the medical treatment of disease process? Anything how would you like it to go? Is there anything you're looking for specifically?
A cure. A cure.
Right?
I continue to, do fundraising. There's a 5K walk that's coming up with the Endo Foundation of America. So if you haven't signed up for that, for all the listeners, I encourage you to sign up on November 1st. But raising money so that hopefully we can find a cure for this disease. I'm a firm believer that nothing is ever 100% when it comes to this disease. So, it's a lot of trial and error. If I've learned anything through being in support groups, it's what works for one person may not work for another. So I'm just hopeful that one day we'll find a cure.
Amazing. Any, lifestyle, either exercise, nutrition tips that you can give? I mean, I've been following your Instagram and impressed with all the high-level workout.
Yeah, one of the things that really helps me is staying active. And so every morning at 6 a.m., I'm down in the basement. I work out at home. So I'm a health and wellness coach through Beachbody. And so I hold an accountability group every month where women can check in, with their nutrition. They get meal plans and exercise programs. And it's just a great way to have fun and keep people, accountable. So for me, it's all about, a healthy diet, and exercise has really helped keep my symptoms at bay, so they're not, so bad that I, can't function.
Amazing. And now with your health and wellness, do you treat, women of all ages, and is anyone? Okay.
Yes, all ages. I do have quite a few pageant competitors who have joined me because last year I was a good 50 pounds overweight, and I was absolutely miserable. I actually competed for the title of Mrs. Michigan America, and I was third runner-up. But one of the things that they told me is that I needed to be healthier, and I really took that to heart. So becoming a health and wellness coach has really allowed me to not only help other women, but it's really, helped myself as well. So I have teenage girls who have joined me all the way up until, 60s late 60s, but, all ages for sure. I mean, we have a lot of fun.
That's great. No, that's great. They're lucky to have access to you and your, education level, and also
Thank you.
your story behind everything.
Thank you. I appreciate that.
That's wonderful. And any other plans in terms of getting out there to really be an ambassador for Endo that we haven't mentioned?
Yeah, so I'm competing for the title of Mrs. America, so I'll be representing the married women of Michigan in January in Las Vegas. So
Awesome.
I will be taking my platform to the national level in Las Vegas, and hopefully the judges will see my passion and see my heart. And as Mrs. America, the sky's the limit. I want to get this message out even further on a national level.
Well, my vote is for you.
Thank you. That means a lot. Thank you so much.
No, I think that, someone with your stature and your level of education and passion, I mean, it's the perfect ambassador, to really just get young women and women in their 20s, 30s, and even 40s just behind you and understanding. I mean, you're a busy mom, a busy working mom with a career, and it's a lot. It's impressive. All that you're doing. It's such great work.
Thank you. I really appreciate that. And, the Mrs. America organization, to be able to represent them and the women of endometriosis that suffer from endometriosis would really be a dream come true for me. So I'm really excited.
And when you win, are you going to plan to just continue everything you're doing really with the education and the schools and the different associations?
Yes, absolutely. Teaming up with, national organizations to get the word out, spread awareness, raise money for continued research. So hopefully we can find a cure one day, and just really getting the message out there. But I think it starts with education in the schools for sure.
I completely agree. Yes, completely agree. And also the medical community, the schools and the medical community. Wow. Yes. This is just all so exciting. And for us, who, we see so many endometriosis patients, just to hear that this is your platform and your mission, it's just overwhelming. So we're behind you. And,
thank you.
We're excited to watch you.
I really appreciate that. And, if we could, just take a couple minutes and just, talk about all the wonderful things that you guys do. Because I know that there's women on here who are joining and, they're looking for an answer, in regards to, feeling comfortable and getting their life back on track and managing that endo pain. So can you tell us a little bit about?
100%. I mean, at Pelvic Rehabilitation Medicine, so we're physiatrists, which we're rehab doctors, so non-operative musculoskeletal doctors who treat the muscles, nerves, and joints. And really what we do is we take a holistic approach to endo, and we understand kind of the connection with the organ system to the myofascial system as well as the nerves. So we really work closely with expert gynecologists to really help not only diagnose, treat, and then manage that whole, we call it that upregulation or sensitization process that happens quite often with endo because it's a systemic inflammatory process. So we really look at the whole person. We talk a lot about nutrition, exercise, diet. We work closely with pelvic floor physical therapists. We do outpatient procedures as needed to really reset and retrain and rehab the pelvis. So we're not pain docs, we're really rehabilitating someone's pelvis. Either pre-surgery or post-operatively we see patients, or quite often patients don't have surgery. So it really just depends. But either way, we'd be involved with pelvic floor physical therapy. And we do a lot of down regulating with diaphragmatic breathing, and then a lot of meditation, as well as kind of retrain your pelvic floor musculature. Because with endometriosis, quite often the muscles go into this guarding state, and we try to release it because a lot of the symptoms are really from the muscle and nerve dysfunction.
Wow. Yeah. So have you seen a lot of success with trees?
Yeah, I'd say that's our most common thing that we see. Our most common teeth complaints are, lower abdominal bloating pain or pain with intercourse is very, very common in our patient population, and a lot of urinary issues, urgency, frequency, and bowel, constipation, bloating. So all that stuff is classic endo. That's what we do all day, every day.
Wow.
So yeah, we, ironically, as a physiatrist, I didn't realize, but we're on the front lines really of endo. Sometimes we're really the ones letting patients know this is what we think it is, and let's discuss. Yeah, so and physiatrists, we love talking about nutrition and acupuncture, and so it's a very holistic. But that's how we always do it. But we just focus on the pelvis, so we are doing pelvic pain and a lot of endo. We have a basic ultrasound guided procedure that we do with pelvic floor PT. Yeah,
wow.
So it's a non-operative approach really to rehab the pelvis is how I would look at it. I tell patients they're like iPhones. We're just kind of turning you off and on, and we're just rebooting everything, calming it down, and then when you're ready, we're going to get you strong. So when patients are ready, we start a neuro re-education program to really get that core firing again.
Wow. That's impressive. Thank you for all that you do.
Yeah, thanks. We love what we do. And we're, again, so excited to have somebody at a high level raising awareness for our patients, and who have been underdiagnosed and really tossed around the system. So the more awareness, the better. And as women, we deserve it. So our patients deserve it.
Absolutely. I mean, there's so many women that reach out to me and, they just say, oh, my doctor tells me I'm never going to get better unless I have a hysterectomy. And that just sounds so final. I mean, it's just do we really have to do that just to feel better? And so I'm so happy that there's other options out there that can, help women who are suffering so they don't feel like they just have to undergo this, big surgery in order to feel better.
Yeah, no, 100%. Yeah. I mean, we are in multiple cities now. I would come see one of our amazing physiatrists if there's any, questions and you want to discuss endometriosis. And again, we work with the team. We always have pelvic floor PT and gynecologists on board.
Nice.
But yeah, we're happy to discuss that, particularly if there's a scary, a surgery that you're considering or just want to discuss other options that are non-operative. That's what we do.
Wonderful. Well, I'm so thankful that, I have this information now because, like I said, I have so many women who reach out to me and they're asking, what should I do and who should I go, who should I go to see? And so now, I'm able to, recommend all of you, which is going to be so helpful. I'm really excited.
Thank you, Stacy. Thank you so much.
Yeah.
This is
my pleasure.
It's fabulous. Keep up everything.
Thank you. Thank you.
Yeah, we're very grateful for what you're doing. It's amazing.
Thank you. My pleasure. It's my passion for sure.
Yes. Good. Okay. Have a great evening.
Thank you so much for your time. I appreciate it.
Bye.
Nice to meet you.
Take care. Bye.